Occupational Self-Assessment (OSA). This is Malay version of OSA. Introduction. The Occupational Self-Assessment (OSA) was designed to guide collaborative treatment planning and measure client-reported change to document therapy outcomes. The OSA is based on the model of human occupation (MOHO) and includes 21 items that represent participation in habits and rules, performance of skills, and volition for participation. OSA has been translated to other languages such as Persian, Malay, and Turkish. Purpose: to evaluate clients' perceptions of their own occupational competence and occupational identity, thereby establishing priorities for change. To be used as a client-centered assessment to guide collaborative treatment planning and to document therapy outcomes from the client's perspective. To encourage client involvement in goal setting and to capture self-perceptions of how illness and disability affect occupational competence. Type of assessment: self-reported assessment. Component being assessed: occupational competence, values of occupation such as skills or occupational performance, which is item number 1 until 11, habituation 12 until 16, and volitions 17 until 21. Indication: people who have insight, cognitive capacity for self-reflection and self-evaluation, basic reading ability or ability to follow verbal instruction, and the capacity to contribute to goal setting. Contraindication: people with poor insight, unable to read, blindness, deafness, and cognitive dysfunction. Administration procedure.
Hai, nama saya Anis Fazlina. Hari ini saya akan menjadi statistik. Hari ini kita akan gunakan beberapa assessment Occupational Self-Assessment atau nama pendek OSA. Cik jangan risau, beberapa ini kita telah terjemahkan ke dalam bahasa Melayu. Assessment ini mempunyai dua komponen, iaitu perkara yang Cik lakukan setiap hari dan juga kepentingan perkara yang Cik lakukan pada setiap hari. Sebelum saya bagi masa Cik untuk jawab assessment ini, saya akan terangkan dulu bagaimana untuk mengisi assessment ini. Assessment ini mempunyai 21 perkara. Cik perlu nilaikan setiap perkara dengan 4 nilai, iaitu 1 sehingga 4. Untuk kotak pertama, Cik perlu nilai berapa baik Cik lakukan perkara-perkara tersebut. Untuk kotak kedua, berapa penting perkara-perkara tersebut dalam kehidupan seharian Cik. Kemudian setelah mengisi kesemua 21 perkara ini, Cik akan memilih 4 daripada 21 perkara untuk Cik ubah ataupun untuk Cik jadikan matlamat dan strategi dalam terapi yang akan datang. Ada apa-apa yang Cik tak faham daripada penerangan saya sebelum ni?
Tak ada.
Okay, ni assessment yang Cik boleh jawab. Sekiranya ada apa-apa yang Cik tak faham, Cik boleh tanya kepada saya.
Administered time 15 to 30 minutes. Scoring procedure. Competence sub-skill. 1. Have a lot of problem doing this. 2. Have some difficulty doing this. 3. Do this well. 4. Do this extremely well. Value sub-skill. 1. Not so important to me. 2. Important to me. 3. More important to me. 4. Most important to me. Clients identify up to 4 OSA items that are priorities for change to establish therapy goals and strategies. This is the scoring from the client. Total up the value for occupational competence and values of occupation. For occupational competence is 44. Values of occupation is 47. What items that client want to change is item 3, 7, 13, and 17. Interpretation. Higher interval scores represent a higher level of client perception of occupational competence and higher degree of value or importance. Psychometric properties. Reliability. Number 1. Internal consistency. The internal consistency of the items that make up an instrument using Cromba alpha is 0.909. The internal consistency of the domain item that makes up an instrument, such as volition, habituation, and skills or occupational performance using Cromba alpha is 0.789. Test retest. Intra-class correlation ICC for all 21 items range from 0.41 to 0.84. Validity. Concurrent validity. OSA version 2.2 were significantly positively correlated with sub-skill scores in health surveillance short form SF36. All OSA version 2.2 parameters score significantly and positively correlate with all false efficacy scale FES scores, which is 0.80 and 0.40. Discriminant validity. Malaysian OSA is relatively independent of scores on the Pain Intensity Visual Analog Scale VAS. Weak correlation between OSA competence and functional autonomy measure system SMAF mental subtask results. Convergent validity between Malay version of OSA with depression, anxiety, stress scale, DAS, and SF36 using Spearman R-ratio correlation coefficient. Advantages. Translated to 17 languages includes Malay. OSA items in combination have good internal validity. OSA is a client-centered assessment, measures unidimensional construct of occupational competence and values. OSA can be used by people with a range of disabilities. Disadvantages. The variability of re-administration intervals does not ensure that the OSA has ability to detect changes in shorter periods of time. No phase, content, and predictive validity. The occupational competence for people with schizophrenia might be overestimated or underestimated because depression can influence their value perception.